We all know what it feels like to be nervous. This feeling occurs when we have to do something we don't want to do, when we have to do something new, or when we have to perform in front of somebody. This nervousness can manifest itself in many ways. For some people, their breathing may become more shallow and much faster. For other people, their heart may race. And for still other people, their hands may shake uncontrollably. But what if you experience this feeling of nervousness all the time for no good reason? Well, then you would have a problem. And according to the National Institute of Mental Health, this is a problem you would share with over 19 million Americans. Psychologists and psychiatrists alike have recognized this problem of excessive anxiety as a growing and nerve-wracking problem. In this speech, I will inform you of the basic facts of the most prevalent of anxiety disorders and their suggested treatments. By the time I conclude, I hope you will gain an insight as to how your more naturally nervous friends and family function. I'll begin by discussing generalized anxiety disorder. Generalized anxiety disorder, also known as GAD, is the most common of the anxiety disorders, affecting between 4 and 5 million people in America. The diagnostic criteria for this disorder are clearly stated in the DSM-4. The DSM-4 which is this handbook right here, is also called the Diagnostic and Statistical Manual of Mental Disorders, 4th edition. It is used by many mental health professionals to diagnose many different types of mental health disorders, as you can see by its many pages. This book states that generalized anxiety disorder is characterized by 6 consecutive months of worry. This worry is usually school or work related, but can also be centered around relationships and personal finances. The diagnosis of generalized anxiety disorder requires the presence of 3 or more of the following symptoms: restlessness, being easily fatigued, having difficulty concentrating, irritability, muscle tension, and sleep disturbance. Also associated with this disorder are incessant trembling, shaking, nausea, upset stomach, and having difficulty talking or breathing. These symptoms must be present for 6 consecutive months for a correct diagnosis of generalized anxiety disorder. Panic disorder is the 3rd most common of anxiety disorders, affecting over 2.5 million Americans. The symptoms for this disorder are very similar to that of generalized anxiety disorder, except the DSM-4 requires the presence of panic attacks. Panic attacks are sudden episodes of intense anxiety, usually lasting about 10 minutes. Unfortunately, they can last anywhere from 3 minutes to several hours. The Anxiety Disorders Association of America says there are 3 types of panic attacks: unexpected, situational, and situationally predisposed. Unexpected panic attacks occur out of the blue, hence the term unexpected. The situational panic attacks occur in a situation where a person always has a panic attack. A situationally predisposed panic attack occurs in a situation where somebody might have a panic attack or might not. The DSM-4, not surprisingly, lists all the symptoms of a panic attack. These attacks of anxiety usually start with an unsettling thought, such as losing control, a fear of dying, or going crazy. These thoughts usually escalate very quickly into an irrational fear, and these are accompanied by many symptoms. To name a few: heart palpitations, accelerated heart rate, excessive sweating, trembling or shaking, nausea, abdominal distress, dizziness, or chills. When these attacks become frequent enough to disrupt a person's normal everyday functioning, a correct diagnosis of panic disorder is in order. Generalized anxiety disorder and panic disorder cover the widest array and display the most common of the anxiety symptoms. There are 7 other disorders with their own specific patterns of anxiety symptoms. I've illustrated these 2 in order to show anxiety's adverse effects on the human body. The Anxiety Disorders Association of America suggests 4 different types of treatment for these disorders: psychotherapy, cognitive behavioral therapy, relaxation therapy, and medication. Many organizations are now finding out that alternative therapies such as art and music therapy are having a beneficial effect on sufferers of anxiety. The goal of all of these therapies is to get the patient to realize his or her anxiety issues and their origins in order to change unproductive or harmful behavior. Psychotherapy does this by examining a person's feelings and with the assistance of prescription medication. Cognitive behavioral therapy does this by gently modifying anxious behaviors. Relaxation therapy does this by teaching an anxious person how to relax and let go of all their anxious thoughts. Medication does this by altering brain chemicals such as serotonin. Alternative therapies do this by producing a psychologically calming effect. In this speech, I've discussed the problems a person with anxiety might have in their life, the symptoms associated with these disorders, and suggested treatments for them. I hope that I've increased your awareness of anxiety disorders and given you a better understanding of anxiety's effect on the body.